Thank you all. Good evening, good afternoon, and good morning. This is the 2181st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. V. Karunakar. And let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money, and you can share it with anyone who loves homeopathy. And we have already uploaded more than 4,000 videos so far. And as you all know, we have doctors from different part of the world, and the purpose is to communicate among doctors as well as transfer the knowledge in between. And that's why we are conducting regular sessions. And today, our guest is Dr. V. Karunagar, who has completed MD in homeopathy and working as the medical officer, Government Homeopathic Dispensary in Nellore, and is the former assistant professor in Government Homeo Medical College, Kadapa, Karnataka, and is the senior consultant, Karunya, Career Homeo Care, Kadapa, and Vinaya Homeo Verve, Hyderabad, and Yeshora Homeo Clinic in Nellore, and he's having more than 15 years of clinical experience, and he has presented some brilliant papers earlier in this forum. And today, Dr. will be talking about clinical evaluation of cases with the interpretation of because giving importance to the interpretation of Hahnemannian approach, what it be, what it can be, because what we are studying is in organon is everything about Dr. Hahnemann's writing, but there is something different we practices in our clinic. So that's the reason why Dr. Karnagar has given such a beautiful uh, heading to clinical evaluation of cases with interpretation of Hahnemannian approach. We welcome Doctor to this session. Welcome. Yes, Doc, you can unmute yourself. Yes, you can unmute yourself and you can speak.
Yes, sir. Good evening to all who have participated in this session. First of all, hats up and thank you very much to all IFPH members. Every day we have to conduct with the different people and different topics which are related to homeopathy. Really, one discussion is equal to the studying of hundreds of books. Why? Because everyone has prepared more than one book or two book or three book. They have understand and prepared a brief content and presented in this session. So at the same time, we are also understand the concept which has given under the standard textbooks. At the same time, the logical application of presenter. So it is very, very important. Every man is a different. So their approach is different. So if you see history of evolution of homeopathy, it has proven. So even though Hahnemann was discovered the homeopathic system, after Hahnemann, the followers, they have their explanations, their approaches are different. But the content is same. Every man aims to cure the disease conditions, but the way of explanation, their way of approach to reach the target is different. The same thing was existing in present scenario. So for classes days together, after seeing or listening the classes in this webinar, I have a doubt. Started one thought process in my mind. So everyone is showing very beautifully the narration of the case, interpretation of the case, and the outcome results also. Don't bother about outcome results. Why? Because which is different from one man to another man. But what we have read, what Dhanesh sir said, what we have studied in the organon of medicine, and what we have applicable in practically quite different. So some experts they have narrated the mental journals very easily. The cases are present like that, or their artistic technique help to narrate those mental generals in this session. It gives surprising. So how nicely, how beautifully narration of those mental generals, which are helps to selection of a drug, are similar to the case. Similarly, another expert has shown the graphical representation of the earlier report and before present report means before treatment and after treatment, how nicely resolving the pathological changes or the parameters in the laboratory investigations like that. So how it is possible to one? Because of their artistic technique and scientific knowledge through which only the possibility of narration of beautifully and logically and scientifically. So after seeing all these things, is it possible in all cases? So if it is possible, why every physician uh, has been doing the same work and to reach that goal? But there is in every case, it is a possible why Hahnemann has given different types of cases and different guidelines has given in his organon of medicine. So in the present scenario, after exposure to practically exposure to sick individuals, they are asked many questions. So one man rushed up into the clinic and shown to the report and only the parameter laboratory investigations, that means blood sugar or blood urea or serum creatinine, they are raised or increased values in their reports. Please give me a medicine, doctor. After using allopathic medication or approaching many specialists, I don't get a result. After that, they have advised dialysis or some other removing procedures. I have heard or listened those procedures are dangerous to my health, or sometimes so many complications are resulting in after that procedure. Like what is your suggestion? What can be suggested in this? Is it any scope is there in that? If you are asking any question, nothing more than that. Few individuals are not at all open up. They are shown to the reports and asking to insist. So even after taking that case, we are prescribing some medicine to that individual within short period or within the period of time. There is no reduction of values. Or some other man has rushed up to our clinic. So the symptomatology is present. Everything is laboratory aspect or clinical aspect is nothing confined by examination methods or other things. But they feel some amount of discomfort. So maybe through life space investigation or history examinations, we can find some characteristic features and prescribing to the remedy. Sometimes they may be reduced, sometimes they may not be reduced. So such a type of experiences we are facing practically, even Hahnemann himself. So after reading, after seeing the cases which were treated by Hahnemann or Kent or Bonninghausen or few people, our stalwarts, so their narration is very simplified procedure is there. So they have simply written some story and indication the drug and according to the date wise when they have to change it, what type of potency has given or like that. The similar phenomena we have to similar headings we have observed in the present scenario, we have present in this session or some other platforms, the webinars or seminars or in the classroom teachings or group discussion. So the quite change I have observed. So either it may be real or not, we don't know exactly, but that enthusiasm bring it to this topic. So either it may be converted into positive type, there may be a chance to correct their mistakes, or there may be given some other thought process to resolve the solution or stand like an inspirator or motivator in front of the homeopathic family. So that's why I have taken up the clinical evolution of cases with interpretation of HAHNEMANN approach. So before going to that, so what is mean by clinical evolution? So generally, the clinical evolution word is used in a allopathic mode of treatment or the medical field whenever the one new instrument has discovered or new protocol has invented. So they are constantly checked up and for either it is valuable or not, they have checked. So for that purpose, the word is used. So clinical evolution is a structured process. There is a clear-cut structurization of the laboratory process or medical device. So how it works, how it is efficacy for testing that or to record the values are like that. So clinical evolution is a structured process of assessing the patients. So the similar phenomena we have to implement in homeopathic point of view, we are also following the structured process, whatever the case taking or whatever the analysis of the case or the studying of the Mater Medica. So we have different varieties of Mater Medica, sir, we are studied. The explanation of Mater Medica is also quite different from person to person. One man has concentrated on clinical aspect, the clinical diagnostic conditions like that. One man has explained a beautiful story. If you take the Kentimeter Medica, one clinical word, one diagnostic word, how nicely explained in the manner of story. So similarly, some other man, he's very nicely a small story which is interesting to remember or analyzing or narration in the whenever the patient is appear. Even modalities or the drug which is entered into the homeopathic point of view are like that. So we are also structurization each and every heading on the basis of scientific grounds and added to logical thinking, logical implementation by our artistic brain. So, our ultimate, what is the outcome? There is a safe and effective either medical device or our treatment procedure, which is safe to the individual, which is more effective to the individual. Effective means to reduce the pathology, to reduce the symptomatology, so to provide the happy and healthy condition into the body. So, like that, in ongoing setting, that activities which are not briefly or vaguely are done for every step, there is a scientific, some evidence, some base, some sound principles were there. We are studied and implementation. But when we have to implement, there is a difference. But the scientific base is same for all individuals or same for all. Little bit changes. The principle is same, but the way of narration, the way of implementation is quite different. So the analytical technique is different. So whatever the technique or principle we have to use that is maybe safe to our individual, it is more worthy to the providing a cures to the sick humanity or other thing. We are getting fame and name through which. So either fame and name, we are earning as a good physician, a good practitioner, good physician, or best doctor in the society, like that. So whatever the efficacy of a practitioner, the efficacy of a one device, uh, deciding by what are the parameters, how they are decided is more efficacious. If we are analyzing like that, so we want to explore certain things. So the generally used for assessment of efficacy of medical equipment. So when it is giving a good result to the laboratory purpose or whatever the parameters which are done. In the laboratory in the present scenario, there is a quite different values we are obtained. The same sample has given to that one. No one has believing in that stage. So I have checked, recently I have started to check blood sugar levels by using glucometer. The value which are getting in outside the lab and inside of the doctor chamber is quite different. The patient himself expressed, I don't want to eat anything till yesterday night. but my sugar levels are very high. Is it right? The mission was right. Is doctor or not? It's showing good true value or not? Like that. So we have checked many times. We are easy to understand the machine has wrong or not. So 2 or 3 times we have to check. Similarly, for every drug which has prescribed to the patient, which is suitable to the condition or suitable to the person, we have checked ourselves. Our mind stated that yes, our adaptive process, whatever the process technique we have to use, it is a right one. So there is a after the standardization that whatever the instrument has discovered used in the medical field, they are standardized. Yes, this is a good thing. Similarly, regarding medicines in homeopathic point of view, certain companies they are very maintaining good quality and other things. So many a times it is a proverb as situated in that one. So is it Germany medicines are very good compared with all Indian medicines or other things? Many a times I have received. Is it really Germany medicine or Indian medicine or like that is there in homeopathy? Even our homeopathic physicians also propagated labeling it is a Germany Swiss medicine. We are using only Germany Swiss medicine. Every man has come to us or they are searching in the YouTube or net also either such medicines are available in your clinic or not. Please show me that label all of it. They are not believing, patient himself not believing. They are checked, cross-checked through YouTube or available technology, either it may be a similar medicine or not. Or a few words which were listened or heard from the mouths of the doctor, they are believing strongly. So really such differences are there. Sometimes we are creating confusion to the one man has stated that there is no such type of medicines are like that. All are equal, all are same. In the government sector, the medicines which are supplied by certain companies, they are not having any label. They are asked which are equivalently competent action showing to the like Germany medicines or other medicines like that. Some medicines are worked very well. Some medicines are not worked very well. They are stated, not myself or some other things. Then we have started a doubt. This medicine is worthful or not. Either ingredients are there or not. What is the parameter to check in that one? So similarly, compare with the modern medicine, certain companies' medical medicines are more worthy. Certain medical company medicine medicine brands are not worthful like that. So here, what is the solution? This is also another important point. So really, we are not using any chemical substances in that one. What is the difference? We are collecting all the sources from the wherever the availability is there. NASA, for example, preparation of NASA, where the NASA is available, they are collecting poison and backward potencies are prepared, and the companies also use the same material. Where is the difference? Why these people are creating for the sake of their self-preservance? So Germany medicines are good, Indian medicines are not good, or some companies like that. Is it possibility is there in homeopathic point of view? We have to think. We are unnecessarily creating some sort of confusion to the patient, all other things. So what Hahnemann speaks exactly regarding the physician, homeopathy is a primarily healing art, but it is always what is the mode of discovery of homeopathy is for healing. It is an art. So it is an experience. So as a homeopathic practitioner, you act like a Hahnemann himself advocated. As a homeopathic physician, you have played many roles as a diagnostician, as a prognosticator, as a surgeon, as a chemist, as a hygienist, as a therapeutician. In the present scenario, in each heading, there is a some sort of conflict is there. In the homeopathic group only, as a diagnostic, few people are strongly suggested there is a need of diagnosis. They are referring the laboratory investigation patient to the lab and take the investigations. Some physicians, there is no need. We are not at all based prescribing medicine on the basis of laboratory investigations. Nothing to us. We are only hunting the or inquiring about your characteristic symptoms, and I am prescribing on the basis of your symptomatology like that. So here, some people are showing over enthusiasm, over interest towards that one. So they are not advising, they are not taking the parameters clinically. Wait for sometimes. What is the present status regarding homeopathy means few people are stated that after using homeopathic medicines, so they are applicable homeopathic aggravation also. Sugar levels are raised first, later on coming down. One doctor is stated like that. My initially, whoever used homeopathy, there is a rising of each and every parameter, then again coming down. Many times I insisted, I asked to my patient, suppose you have coma, after prescribing a medicine, it increasing the coma and bring back to the normal. It is a silly statements like that. Don't believe like that. So here it is our responsibility or not to check the clinical parameters, either hypertension or blood sugar levels or serum creatinine or blood urea or hemoglobin, like that. We want to show as so homeopathy himself stated that evidence-based medicine. So it's our duty to show sometimes what I have observed in certain cases, there is no change in the parameters. There is a lot of change in the symptomatology. Patient himself stated, I feel comfortable, doctor. Nothing is there after taking this medicine. I feel so happy. Even physician also never advised. Even sometimes he advised patient is, why doctor you are prescribing a laboratory investigation? I am feeling very happy. I don't want any lab investigation. Whenever I'm sick, then I have to. So, meanwhile, what happening? Some amount of bad credibility credited into the homeopathic doctor's view or system's view. It is our responsibility to diagnose the problem, not only for. So, diagnosis we are not used for the selection of remedy, but diagnosis is used for to understand the pathology. Either it is a bring back to normal or not. What is our duty? As per third aphorism, Hahnemann stated, what is curative in disease? Without knowing that one, it's a very difficulty to understand. So, what are the changes which are related to that particular organ or that particular pathology, or it is compensatorily developed or directly developed without understanding? Sometimes the compensatorily changes are developed without any real involvement of that organ. So our aim is to treat which one is involved, not treat the compensatory involved organ. So these are so here is also we are creating some amount of confusion. Diagnosis is needed. Even in the classroom teachings, we said we are not treat the disease. We are not we are treating only the sick individual. A student has understand it means there is no diagnosis of problem like that. So here our duty is to diagnose how we can use this diagnosis for our treatment. Or if you read some clinical mathematics, there are each and every value, even urine, specific gravity is increased, specific gravity is decreased. So this laboratory investigations it helps to us to know the tendencies or diathesis. In mathematics, clearly described lithic acid diathesis. So how you know there is an increase in levels of uric acid or stone formation tendency in that one. So how to understand those laboratory investigations or diagnosis part is very important to check yourself after prescribing for a period of time, it become a normal. The changes is you have to decide yourself either we are able to bring back to the changes normal or we are adapting the individual, the sick individual to the existing pathology without any. So this is called as a cure in the present scenario. So existing without any difficulty, adaptive to the existing pathology. Later I will discuss as per Hahnemannian concept, there is acute and chronic diseases are there. Kahneman himself clearly stated that one, the chronic diseases are lifelong destructive process. There is no cure. In the modern medicine, it has proven BP is lifelong, diabetes is lifelong, nephropathy is nephrotic syndrome or nephritis is lifelong. They have only controlling the parameters through which they are promoting the healthy lifestyle. What happening? What is the role of in homeopathy like that? Either we bring back to that everyone, we are also able to reduce that parameters or only symptom relief, or either it is a palliative mode or in the curative mode. For understanding this, our diagnosis is more important. Similarly, as a prognosticator, every patient asked, so what is curative? Here is also we are creating some sort of confusion to the patient or some sort, even to the student or homeopathic practitioner. How long? How long? No one can answer to this question. Why? Because it only depends upon the individual which is reacted to the given similar remedy. Even medicine is good, can't do anything. Even medicine is good, but body is not in a position to respond. What we can do? Nothing. So here, if you want to diagnose, if you want to estimate a prognosis of the individual or prognosis of the disease means either medicine and the reaction of the individual both are estimated. It depends upon the reaction in between action of the medicine and the reaction of the individual. So as a surgeon, here is also again many as per Hahnemannian approach. So if you are treated initially, if you are understanding the patient, there is no strictly surgical disease, either as 13th aphorism or some other surgical diseases. So most of the diseases are dynamic in area, except few instances, either mechanical accidents or certain in those conditions. So you have to, or sometimes where there is a mechanical obstruction is there, there is a need to remove such obstacle. Mechanical aid is required. You have, it is your duty to understand where the requirement is. Don't be foolish or I have to cure, I have to stop this in this manner or like that. So many conditions are given, even surgical conditions in the Metromedica or in that one. So you have to understand the body prognosis. Prognosis is more important. It's going to be a fatal or it's going to be a healthy condition. So you have to understand either you have act like a surgeon, you have to remove that one or through your medicine, or you have to refer there is a real surgeon means where there is a requirement of real medical aid. As a chemist, here is also understanding in the present scenario, many ingredient. At the time of Hahnemann, he was used only certain drugs. In the present scenario, under the brand label, so many preparations are vitamins. Even our homeopathic people are used as a vitamin. So vitamin substances, herbal products as a co-component along with our medicines. They said Hahnemann himself stated that so he was taking auxiliary line of treatment or auxiliary method. So without dietary regimen correction, we are unable to cure. Like that, even patients are the physician started to think in the businessman mind and encourage so many compounds. Either it is creating pavement to the real cures which are possible by homeopathic system or not. So again, there is a doubtful. Where there is a requirement of hygiene changes or dietary changes, we have to correct it. So Hahnemann himself stated many times through encourage through a natural diet, either fruits or some other things, not the artificially prepared that thing. So as a hygienist, this is also again question. Homeopathy man is created very clear hand you have to take the medicine without so some special precautionary measures are explained to the patient. This is also most of the is it Hahnemann explained such a precautionary measures in any paragraph of any textbook in his literature. His explanations are quite different where there is a because of unhygienic conditions the disease condition is prevailing where in those circumstances there is sometimes the patient is unable to maintain such a specific precautionary measures, they are not forwarding or come forward to the homeopathic system through which we are losing or we are creating some amount of loss to our system of medicine. So, like that, as a physician, you have to understand all these things. So, what is there in clear literature, you have to clearly implement them as per clinical. So, that is called as a clinical evaluation, which is how much investigative procedures are required, what are the investigatives are required, what are the things we have confirmed through clinical examination or history taking or a family life spacing scene. Here, regarding that, there are two types of diagnosis, either what may be a disease diagnosis and person diagnosis. Disease diagnosis based on so examination and clinical laboratory investigation. Person diagnosis means history, life space investigation of each individual. Is it everyone is able to clearly explain? Nothing, nothing sometimes. We are close acquainted. So that's why Hahnemann clearly stated, who is act like a family physician to the patient, then only they are open up their secrets, their all other things. Otherwise, the family conditions are act like a maintaining cause. We are unable to cure. I have to explain one thing. So a couple came to me and a wife has explained I have a headache. Husband has explained always he is sick, always he is sick. I asked why you are sick like that or you are developing headache. Because of him only. Because of his works, his activities, not at all tolerable in the house. Here, he is act like a very gentleman, but in the house, either we went to house, we have to see, examine either which one is right, which one is the thing. Without, sometimes we have to create circumstances in our dispensary side or close acquaintance with them while talking only. Even you are many more questions are framing, so then only there is a possibility to get some details from the patient's mouth. Without understanding all these things, very difficulty to selection of getting a clear-cut mental picture or understanding the accessory circumstances of the thing and a individual. Without understanding all these things, very, very possible. Hahnemann never explained here, if every case you have to get into all the details, then only possible to cure or like that. Sometimes there is a paucity of the symptoms, paucity of the case. You have to triggering, they come out into that one in the cleaning process. If you started to clean the house, so every day some amount of dust is coming, even though you have to take precaution. Similarly, in the chronic cases, inside derangements are come out into the surface is in the form of many patients are said, what is this doctor nuisance? One symptom is going on after taking your medicine, another is coming. One is going, another is coming like that. So one is going, another is coming means so the body is elevated, all the things in outside for cleaning process of that thing. So that's why there is no parameters to decide a normal phenomena, normal expressions and abnormal expressions when you are master in the psychology. So this is, so the physician's success depends not only on their knowledge, but also on their ability to grasp the characteristics which make each human being an individual. If you see the individual, you have to understand. So every student is a knowledgeable student. Every practitioner has good knowledgeable person. But some people are shamed because they are understanding, they are grasp the individual characteristics, understanding. So either medicine is required or what is curative in that case. So he grasped that one, he is able to. So that's why he is easily shamed. And he is famed as a good doctor or best doctor in the society. But all are knowledgeable persons. Why? Because the utility of use of that knowledge in logical manner, artistic manner, so then only we are shown as a better physician or best physician. So here in the modern medicine, there is no such a, even modern medicine also, there is a fixed medicines are there. For fever, there is a paracetamol. All doctors are should not be considered as a good doctors. Few doctors are considered as very nice doctor or other thing. Why? There is a little bit difficulty in homeopathic system of medicine. Why? Because it based on the individuality. So many number of medicines are there, one particular condition, all other things. But in allopathic mode of medicine, only one medicine, laboratory investigations are fixed, diagnosis is fixed. Once diagnosis is fixed, they are easy to give fixed dose of medicine for a fixed period of time. But here is also all are not shamed because they, even though they are knowledgeable person, but they are communicate or not, the ability to grasp the patient's individuality in treatment, all other things. So in general modern concept, they have fixed specific medicine, as Hahnemann explained, below the wise. Below the wise. There is a fever, Dolo 650 daily TID doses for 3 days or 4 days or maximum 1 week like that. Is it any fixity is there? Many people are feel bad in homeopathic system of medicine or that thing. So we are not having such things. But sometimes even that fixed doses are used, they are not controlled. So many consequences are there. So that's why Hahnemann was understanding the process of disease. Disease is defined as dynamic process. Individual reactions are quite different during that. Our science is made like that individualistic science. So he was given fixed guidelines. Here, you have to fix up the dose and medicine to your sick individual. In allopathy, it is a common. There is no difference between a common man and a qualified man once you know the diagnosis. Even in homeopathic system of medicine, you know that one, but there is a lot of difference. Why? Because in each every circumstance, every moment is quite different. Or number of medicines are there. Which one is exactly suitable? That one, then only it is possible. So homeopathically have to fix the medicine by using your scientific knowledge, artistic brain, and logical evolution. These three qualities are very, very essential while taking the case and studying the mathematica and prescribing, understanding the patient and prescribing the remedy. So that's why Hahnemann clearly stated, so allopathic man is a salesman. He's not a physician, actually. Why? Because here salesman means not the selling of that thing. He is a fitting the dress, already prepared, ready-made dresses are there. They are fitted into the individual. He is not made anything. But our homeopathic man is not like that. He is a natural tailor. He was preparing the dresses, which one is exactly fitted. Sometimes they are fitted in modern concept, may not be fitted. But here, always each and everything is fitted to that one. Why? Because you are the only personally you have to understand and personally you made it that one. So that's why our master CFS Hahnemann advocates the physician clearly perceives what is to be cured in disease, that is to say, in every individual case of disease. That is called as a individualistic approach or holistic approach, whatever the thing. Here we are defined in different aspects in the present scenario. For in every what I have observed, what I have grasped, for every medical profession in this one, there is a standard guidelines. But in coming to the homeopathy, so there is an individualization standard line is there, but everyone is behaved individualistic manner. So that's why we are not achieved or up to the mark. Why? Because there is a clarity in that one. Which procedure, what are the diseases are treatable, where the scope, all other things clearly defined. Anyone. But in homeopathy, not even so. That's why many gossips or false news are releasing into the public. We are fight with one. So always we are nullifying those things. Our time is wasted like that. There is no sound voice rising. This is so why? Because recently Dr. Preeta Madam came from Kerala. So he was explaining very nicely, beautiful in one seminar, reorientation program. This is protocols of that one. I asked, so if such a protocols are there, why you should not standardize each and every state? One state it is a good one, another state it may not be a good, or different procedures, different approaches are there. You have to fix up. Then only is which one is exactly fitted into the homeopathic system to bring out the real worthy of homeopathic system are like that. So Hahnemann was clearly given all everything, clear guidelines, either it is a disease or a drug or application of the disease knowledge or drug knowledge or other things. So what are our fundamental principles? So monopharmacy, minimum dose and cure the diseases. Is it a few, we have to count on fingertips who is used a single medicine in the government sector side or private sector side. So definitely more than even myself. So why? Because there is a stock. I have to prescribe one single medicine. Patient is not satisfied. Please give me another thing. I have to prescribe one biochemical tissue salt, or where it is a need, and one more salt is also unnecessarily given to the patient sometimes. Why? Because which is a vitamins of homeopathy. Certain people are habituated to indulge that mother tinctures. So to clear up our stock in the thing so forcibly, especially in a case of where what is the clear-cut indication of that mother tincture prescribed to the patient is where the physiological doses are required. So along with the original dynamic medicine, one physiological doses we have to give forcefully to that thing to observe. Then only patient satisfied. We know very well the real outcome or real action is possible only by a dynamic action of the medicine. So here, number of medicines. Even in the YouTube, they have described a renal stone is there, lycopodium, midorinum, and Peridia breva, hydrangeia. Everyone has used, but there is no result. If result is happening like that, so there is no need to study a homeopathic system, what in Medramedica or Organon or medicine, other things. Even obesity drops. Dr. Rakwa has prepared 147 drops. So for every label is there, clear cut indication is there, in tube one catalog is there, very easy to prescribe. It is not such a type of science. If it is possible to cure all the diseases or getting positive result, there is no need of study of homeopathy 5.5 years. It's a very easy, quite easy to practice. Or why even whoever came out from the institutions, they are afraid to practice of homeopathy means such a things are not possible. Why? Because such a logical connectivity is there. So everyone is habituated forcibly to polypharmacy or combinations for the sake. Even though he is able person, good purpose. Reasons are different. Reasons are different. Maybe money purpose or maybe lack of knowledge or many for the sake of satisfaction of the patient for that one. Whatever the reason, ultimately we are deviating our Hahnemann approach. That means a monopharmacy or minimum dose. So we don't expect cure when you are not following the Hahnemann principle. Clearly stated. Everyone has used that one. So every homeopathic man is forget about the curative process. Why? Because everyone is defined in the present scenario, the cure is possible. And many times when we are not characteristic, because of our laziness, because of lack of interest towards that one, we are habituated to prescribe favorite remedies. Either rheumatism is there, Rastax, gas trouble is there, Naxvamica, or some other things. Where is we have observed and analyzing and think may not be applicable. So few people are there, 100% they're doing, but majority of people we are seeing like that. At one particular point, lack of patience provoke the mind to habituate the combination, to prescribe combinations or favorite remedies or like that. So that way it may can damage some amount. We are not getting proper result by Hahnemannian approach. So the homeopathic approach, whatever the case taking also here, analysis, evaluation, how to observe too. So some people are adopting or giving too much importance to analysis and evaluation, or some people are not giving important, less importance to that one. And the time spending also. One man has given 1 hour, 2 hours time, one particular patient. Another man has given or 15 minutes or 20. Here there is a variations in that one. But it maybe depends upon the case, it depends upon the habit of the physician. But what is the actual standardized position? It can be decided by the disease nature and the individual and the physician. May not equalize all. So if you are getting 1 hour time spending with patient, we are getting more characteristic. 1 minute time, we are not getting. In a case of one-sided disease, what you can, even you are in a case of chronic disease, so Hahnemann himself stated that one, there is adaptation takes place. There is no active form of symptoms. Patient himself forgetted, imperceptible beginning. The patient is unable to remove. Or it is more difficult in the present scenario. Why? Because he was using some herbal medicine or home remedies or allopathic medicines, all of them at last stage come to the homeopathy. Whatever the symptomatology has given, even you are giving, asking nothing. So that's why there is a equalize, there is a free from that one. There is a time spending get more characteristic. If you are not spending time, less characteristic like that. So it defined based on the case. Different cases are explained. Different procedures are explained. If you are understanding the procedures of Hahnemann, so very easy to understand. So I want to show a few cases also later. So the selection of the remedy, individual concept is also based on here. Everyone stated based on individualization. But everyone said what clearly Hahnemann spoke in the literature or applicability, but here we are lacking. That lacking of scientificity and logicality in our individualization. So that's why we are unable to get a proper results what Hahnemann explained in the first and second aphorisms. So many more. There is a nothing. So analysis of results, everyone their own way, all are discussed the success stories in practicality. So it's not perceptible. Everyone stated, I succeeded in so another. But where is the failure? Everyone is succeeded in that one. Why we are stand behind? Why not we are discussing anywhere in any seminar I treated this case, I failed, this is remedy. Till now, after that, I have learned so and so that point. We are discussing, we are not. In every way in the sequence, every step by step, ultimate what decide, we are obtained, decide and cure. The patient is good, even years together, all other things. Such results are possible. Why? The humanity is existing in the on the earth, on the state. Everyone is even. That is the so their own way they have to analyze. There is no standard procedure for to publish the result of homeopathy, all other things. Even research institutes. I never see, I worked as a lecturer in 10 years. I never received this is the research protocol. I have seen in modern prestigious college what type of research work is going on. I'm not criticizing anyone. Because when I see such a type of procedures, some sort of heartfelt pain. Why these people are doing like this? Why not a genuine procedure? Why not publish the genuine result to the thing? So that is that thing. Even 100% OP is there, 100% success rates are there. Why? We are not up to the mark. Where is the failures in that one? That means in the practicality, it is not perceptible. So that's why the cure, everyone is for what is meant by cure. So restoration, we have studied in the practically what is meant by restoration, what is meant by. So if you are asking practically, show me, nothing is there. Simply reduction of symptoms is considered as a cure. But Hahnemann clearly stated that the reduction of symptoms, most of the thing after prescribing a remedy, patient get good result. We feel so happy. We never investigate further. Whenever patient stated very, I feel comfortable, we never further investigate that case. We are just repeating the medicine or we are handed that case. Even patient himself like that we are. So I feel comfortable. I never. I want to show such a type of cases also. I read. I when I used medicine, I feel comfortable. Never you come to the clinic, again visit. So the what Hahnemann defined cure, what we have applicable to cure is quite different meaning. What is the Hahnemann approach? What as a Hahnemann and disciples we are adopting the curative or explaining the meaning of cure is it? Is it possible? It possible in the cure is possible in the present scenario? Why? Because everyone has distributed all varieties of medications are indulged into that one almost drug induced disease. There is no true natural diseases in the human beings. It is the biggest question. So you have to explain what is meant by cure. So in my point of view, you ask the same question. So that is only adaptation, adaptive and removing of the tendencies. Clinic adaptive and removing of tendencies and dyscrasias. Why? Because acute disease cure is possible in the chronic disease. So when you are treated in the early stage to remove the miasmatic block, then only cure possible. Only up to 50% cases. But those 50% cases also not available because of patient different patient thought process is different. They are unable to stick to treat in such a manner. They are spoiling. So what Robert speaks, so deflected current is very, very 100% truth. So the clinical assessment in modern medicine and in homeopathic point of view, quite different. So reduction of clinical parameters is called as a cure in allopathic point of view. So either symptoms are reduced or not, may not be a bother about. There is a reducing all parameters, laboratory investigation. There is a good, there is a cure. Your disease is cured or managed. You have to continue the same treatment for a period of time. This is also approach. So what Hahnemann exactly invented this homeopathic theory, maybe a minimum dose or long-standing, free from long-standing therapies, but we are habituated to for run long-standing uses of long duration and large doses of medicine. Number of regarding doses, different types of opinions are there in the individual's mind. So who is right, who is not right, we are unable to discriminate. We leave it regarding potencies, regarding this. So most of the people are unable to understand what is the difference between the potency, one potency to another potency. Yeah, really, in my point of view, for asking, so what I have felt, so there is a variation of the action of velocity of the action. There is no difference in the action, either lower potencies to higher potencies, but the symptomatology has evaluated in that one, but velocity is completely changed. So that's why the regarding repetition, regarding given the potencies, certain precautionary measures are given by our master. But in homeopathic point of view, also in the present scenario, just free from the symptoms, it is called as a cure, but it is not a real cure. So that is, which one is a real cure? We are unable to define. So as per my opinion, so balancing both. So what is real cure in the present scenario? You have to show reduced all parameters as a clinically and free from all symptoms and how much active earlier. So you have to restore it or bring it to that state. It is called as a real cure. May not be possible in all cases. So how much possibility is there? You want to show by your way of treatment. So adaptation and the removing of tendencies also considered as a cure in a case in a chronic cases. Dyscrasias, stop the dyscrasic tendency. So stoppage of progression, adaptation. So, for example, in miasm is called may not be bring back to the all, but active miasmatic state turned into a inactive or dormant state, we consider as a cure in the present scenario by prescribe by using miasmatic remedies. So to stop the progression, so pathological turning one stage to another stage is also considered as a cure. Adapt without any difficulty to existing to survive his life with his condition is called as a cure. If you see one case, I have to give on Hahnemann. So how nicely, simply two or three symptoms are written, and you have to change one. You have to observe. This is case from lesser writings. A girl has developed headache, all other things. It was used belladonna in periodically. How if you read that one, when we want to repeat the guidelines of Hahnemann as clearly reflected when we want to increase the potency. So here, everyone we are explaining this is the point. But what is exactly scientificity and logical evolution in that thing lacking? If you following that one, you are 100% success in each and every case as a parameter. So that 100% success means not a cure. So 100% justice to the patient like that. So how nicely given that one belladonna to a one potency, belladonna two potency, third, middle of that there is a change of the symptomatology. He shifted to hyoscamas and hyoscamas one, all other things. Maybe in a case of sore throat, he was started. So middle of that he was used sulfur. So very nicely, the given remedy and reflecting symptomatology is exactly matching. But in the present scenario, we want to match that one. We want to match, there is no logicality. I automatically, when they are matching, that is more practicability. So automatically cure. So there are so many reactions. Second prescriptive methods are that thing, observations are also there. So you have to see a person, a case of general pruritus came to me and he is explained his symptomatology. All over the body, itching is there, especially nighttime aggravation is there. So whenever he was his mind is occupying, so concentration is not on his eating or scratching that one, he is able to maintain that. On that base, I prescribed sepia to this patient, and a 15 days period or 1 month period he has taken that one. 200 potency is available. I have to give only 200 potency this case. So within 15 days, very slight result is there. After that, I have to repeat the same sepia 200 on keeping on SL, and within one month period, the complete disappearance of symptoms. Patient has started thinking, yes, I am free from that one. I know as a homeopathic physician, it is a chronic case, but it may not be resolved easily. So after 3 months period, he got same set of symptoms. He was visited again in my clinic. Sir, when you have to prescribe the remedy, I free from all the symptoms, but after 3 months period, again the same set of symptoms. That means this is, so what happens, sir? This is, I clearly explained, because of medicinal action, you are getting good result, but your body is not rectified. So your body is not in active mode. Under the influence of medicine, you get the result. So medicine action has disappeared. You got your own previous symptoms are like that. So what is that? This is the real indication for to prescribe a miasmatic remedy to remove the tendencies. Without removing the tendency, that means a miasmatic block, even though you are giving a right remedy, all other things you are unable to cure. This is called clearly stated. The psoric is a, so it when you are not stop here, it goes on some other conditions, either syphilitic sting or psychotic sting or tubercular sting, whatever that, multiple complications. That's why many patients in the present scenario, at the time of Hahnemann, the skin problems are very challenging to modern medicine. In the present scenario also very challenging. Most of the people are having the skin issues for longer period, longer period. That is the another thing. So what we have observed. So this is what I am clearly explained to you is, so here another important point is, so you understand Hahnemann in miasmatic 3 is very, very clear. This is also another important case. So he was used allopathic medication one month period, but he won't get a good result. So after that, is it any scope is there in homeopathy? I He is explaining he was stopped allopathic medication and started our homeopathic medicine for a period of 1 month only. So I prescribed him lycopodium based on his symptomatology, other thing. In addition to that, physiological dose, cesium, mother tincture. Within 1 month, he was checked his blood sugar levels and coming down. Even after that, he stopped his medication for 3 months period. After 3 months, once again he had checked. His values are normal. He feels so happy. So initial stage of this is what indicates it reflect means in the initial stage you have treated in a right simillimum to the patient. So the pathological progression is stopped and body has rectified. Once body has rectified in the mechanisms, you are unable to get. Even though it is managing metabolic disorder, that means in a case of metabolic disorders, what is mean by cure means there is no rising of values. All metabolic activities are in perfect manner because of your medicinal action. Medicinal action. This is another important one. So this is another important case. So here I never spend any time. When I was sitting in the camp, medical camp, a patient came from Delhi. So here one famous ashramam is there. Here the lady who patient was visited because of she has allergic to outside food. She has taken some amount of food in the train and the change of weather. Only I have based on characteristic of change of weather and change in food. So she was showing epigastric pain, severe epigastric pain. Even after taking allopathic medicine, she won't get the result. And I prescribed one dose of Palstella every half an hour period. Within 1 hour, her reaction is like that. I recorded that one. So that is why similar. So here my observations and conclude on this topic is truths are always criticizable, but they are always outstanding performance. So don't confuse and don't create confusion. Why? Because here most of the time we are not getting proper result because of confusion. Hahnemann approach is very simple. Try to understand and implement. Don't fix up the pathway. You cannot decide. Learn all pathways and experience it and understand it, and you have to adapt which one is exactly suitable to your patient or your body nature. Either it may be a case of Either it may be case taking or drug selection or whatever the research work. Don't forget about the fundamental principle. You have to done another thing. So on clinical evolution means balancing all parameters and with free from symptoms. So that means a restoration. Whenever the values are reduced and restored. So man is a simple to look but a complex to study. Homeopathy is a complex confused to study, very simple in implemented. So by seeing itself, homeopathy is so many things are there. Once you have to understand, it is very easy to implement. So don't struggle for results. Do hard to use your knowledge. Don't expect the result. You have to, what you know, you have to implement on that one. Automatically you get it that. So you have to, don't forget the technique. So free from
Yes.
laziness and raise your voice about your results and system. Show your efficacy to seek humanity. The seek humanity will talk. There is no need to use your voice. So unite with all whoever fight for preserve the integrity of our system of medicine. Don't quite sitting quiet. You have to unite with them whoever fight. So my intention is to bring out your talent as a person and as an organization, but not the criticize. Hahnemann approach mean you are a better than me. Hahnemann is always stated that you are better than me. So like that,
Yes.
you are always better than me. My action is creates many solutions. So because of through it, you are showing many solutions to your upcoming following. So that's why my hope and my desire, forgive with any kind, any wrong things are there in this message. With kind heart, you are forgiving me. Thank you very much for giving this opportunity.
Okay. Thank you, Dr. Karnagar. It was really an excellent session, and we loved it, and we really enjoyed the session. Your cases were exceptionally brilliant ones, and this kind of presentations can really take homeopathy into another world. That is how homeopaths need to look into cases. And anyway, congratulations, and I'm inviting. Since there is no time for discussion, and we will have to to close the session immediately. I am inviting Dr. Bob Reed to say a word of thanks to the session. Yes, Doc, you can say the word of thanks to the session. So I'm inviting Dr. Ambaresh sir to say a word of thanks.
Other sensory is a physical form, madam, or dynamic action is always mental level, means invisible form. Where the material changes are there, the physiological doses is required, which shows structural changes, but dilutions are dynamic in nature, when they act
Please.
on alter the state of health.
Yes, Dr. Binoy, you can say a word of thanks.
Yeah.
Yes, yes.
Hello, Dr. Karnar. It was a very, very good session, and you gave uh, the basics to the next level, how the homeopathic medicines work, and how you get to the simillimum, and how the actions that the cure, how the homeopathy medicines cure the diseases, are basically something similar to the Herring law of cure. It was very, very enlightening session. Thank you very much. And we expect you come back with another interesting topic in your next lesson. Thank you very much from IFPH standpoint and all the participants standpoint. Thank you.
Thank,
Thank you, sir.
thank you, Dr.
Thank you.
Binoy and Dr. K. Karnagar, and those who V. Karnagar, and those who attend the English session. Tomorrow we will have a session from Dr. P. Nitish, and Dr. will be talking about a structured approach to clinical reasoning in homeopathy, part 3. So hope all of you will join at the same time tomorrow. It's over to our Malayalam moderator, Dr. P. Shaila. Thank you all. Good night.